Hey everyone, and welcome back. You know how much I love these deep dives into your health questions, and today is no exception. We're going to get into IBS, irritable bowel syndrome, but get this with a twist.
The twist.
Yeah, twist. So many people out there are dealing with not just the typical IBS stuff, but also like urinary problems too. And they're like, wait a minute, is this connected?
Yeah, it's something that a lot of people don't realize can be connected, but really can be.
Yeah, so maybe for those who just tuned in who are like, what is IBS? Can you give us a quick IBS 101?
Sure. So IBS, or irritable bowel syndrome, is a really common condition.
Mm-hmm.
It affects the digestive system, and it causes all sorts of uncomfortable symptoms like cramped abdominal pain, bloating, gas, and then you get into changes in your bowel habits.
Right, like diarrhea, constipation, that whole uncomfortable situation.
Exactly. And, people think it's just a gut thing.
Right. Yeah, you think oh, stomach problems.
But it can actually impact other parts of the body.
You're kidding.
Including the bladder.
Okay, now we're talking, because that's where this whole urinary symptom thing comes in, right?
Exactly. And there's actually a term for it. It's called IBS with urinary symptoms, or IBSU.
IBSU. Okay, got to remember that one. So what are we talking about here symptom-wise? Because if someone's listening, what kind of things would make them think, oh, this isn't just me, this could be IBSU?
So imagine this, you constantly feel like you have to pee all the time, especially at night.
Oh, no.
Right? Or maybe you have pain when you're trying to pee, or burns, or just a weird sensation.
Yeah.
And then there's that, when you go and you just feel like you didn't really empty your bladder.
Yeah. Oh, the worst.
Yeah, those are all red flags that maybe you're dealing with IBSU.
Yeah, and I imagine with those symptoms, you might not immediately think IBS. You might think, oh, something else is going on, right?
Exactly. It's often overlooked or even misdiagnosed. And people get frustrated because they feel like their symptoms are being dismissed.
Absolutely. It can be so frustrating when you know something's off, but you can't figure out what it is. Okay, so we know what IBS is. We know some of these surprising symptoms. Now the big question, why? Why are these two things connected? They seem so separate.
Right. It's actually really interesting. So one of the main theories is inflammation.
Okay, so inflammation's a big buzzword these days. Can you break that down for us? How does inflammation play into this whole IBS bladder connection?
Absolutely. So with IBS, you often have inflammation in the gut. And because your gut and your bladder are kind of like neighbors in there, that inflammation can actually spread and start affecting the bladder too.
Oh, so it's like if you have a really messy neighbor, their mess starts spilling over into your yard.
Exactly. And that's what causes a lot of these uncomfortable bladder symptoms. But inflammation, it's not the only factor.
Okay, so what else could be going on?
Well, there are things like chronic pain conditions, which can show up in both the gut and the bladder. So you end up with this overlap of symptoms.
Right, so it's not always clear what's causing what.
Exactly. And then there's the gut-brain axis.
Oh, the gut-brain axis. We hear so much about that these days.
It's incredible, really. It refers to this constant communication between your gut and your brain.
So they're texting each other all the time?
Pretty much. But sometimes those signals get crossed. And that can really mess with both your bowel and bladder habits. You ever notice that when you're stressed or anxious, you suddenly have to go to the bathroom?
Oh, 100%.
That's the gut-brain axis at work. Your mental state is directly impacting your gut and your bladder.
Mind-blowing. Okay, so we've got inflammation, we've got this gut-brain connection. Anything else?
One more thing. It's also possible that the bladder itself is just more sensitive in people with IBSU.
Okay, so explain that one. What makes the bladder sensitive?
It's thought that some people just have bladder muscles that are naturally more sensitive, which makes them more prone to things like urgency and frequency, even without IBS.
Oh, so they're already starting at a disadvantage.
Right. And then when IBS enters the picture, it's it just amps everything up even more.
It's like turning up the volume on those symptoms.
And here's where it gets even more interesting. Women tend to experience IBSU way more often and more intensely than men do.
Is that right?
Unfortunately.
Yeah.
Yes, more common in women, and when they have it, their symptoms tend to be worse. And that's a whole other conversation about how IBSU specifically impacts women.
Absolutely. And a really important conversation to have. We've got to dig more into that.
So one of the biggest ways IBSU impacts women is how it interacts with their periods.
Oh, man, you're talking about a time that's already like a roller coaster for so many women.
Exactly. And IBSU can make those period symptoms like cramps, bloating, even the runs, or constipation way worse.
Oh, no, it's like adding fuel to the fire.
And it's all timed perfectly with their cycle.
Yeah.
So you're already dealing with stuff, and then bam, IBSU comes in and makes it even worse.
It's like it knows exactly when to strike.
It can really mess with a woman's life. You
For
know,
sure. And it's something that I think a lot of people don't talk about enough. So it's great that we're getting into this. But, beyond just the physical symptoms, we also got to talk about how IBSU can impact intimacy and relationships.
you're right. That's a really important aspect too.
Yeah.
We're talking about things like pain during sex, which doctors call dyspareunia.
And that's more common than people think, right?
Absolutely. And it can be really tough on women dealing with IBSU because it affects their relationships, their self-esteem, their whole sense of well-being.
Totally. I mean, if you're experiencing pain during something that's supposed to be enjoyable, it's natural to want to avoid it altogether.
Exactly. And the crazy thing is, the root cause of this pain often goes right back to what we were talking about before, inflammation and muscle tension down there in the pelvic region.
So the same culprits that are causing those urgent bathroom trips are also messing with things in the bedroom.
You got it. And it can turn into this awful cycle.
Hmm.
The pain leads to less desire for intimacy, which puts strain on relationships. And then the stress from that just makes the IBSU symptoms even worse. It's like a domino effect.
Oh, it's like your body is working against you. Okay, this is where I want to shift gears a little bit and talk about solutions, because as much as we need to understand the why, I'm sure everyone listening is like, okay, but what can I actually do about it?
Right. So while there's no magic cure, the good news is that IBSU is manageable. There's definitely hope for better quality of life. But it's not one size fits all.
Okay, so what are some of those management strategies we need to know about? Let's start with something I know a lot of people wonder about. Diet. Is there a specific IBSU diet or what?
It's not so much a specific diet, but there's one that often helps. It's called a low FODMAP diet.
Okay, the low FODMP diet. I gotta be honest, whenever I hear that, I always picture like rice cakes and water for every meal.
Yeah, a lot of people think it's super restrictive, but it's really not that bad.
Okay, so it's not like a culinary prison sentence.
No, not at all. It's more about figuring out which foods trigger your symptoms and then learning how to manage those FODMAPs. Are these types of carbs that some people have a hard time digesting, and they're hiding in all sorts of foods.
Really? Like what?
Yes.
Give me an example.
Onions. I used to love onions, put them on everything.
Wow.
Then I found out they're high in these things called fructans, which are a type of FODMAP, and my gut just couldn't handle them.
You're kidding.
Nope. Once I cut back on onions, it made a huge difference.
So it's like detective work. You have to figure out who the culprit is in your gut's mystery novel.
Exactly. And there are other common culprits too, like garlic, certain fruits, dairy products, even some sweeteners.
It's like they're everywhere. So instead of banning all FODMP, you work with a dietitian or someone to figure out your own personal triggers and then go from there.
Exactly. They can help you make sure you're still getting all the nutrients you need without all those uncomfortable symptoms.
So it's all about balance.
Exactly. And along with diet changes, medication can also help manage those IBSU symptoms.
Okay, so when we're talking medication, are we talking about something that's actually targeting the root cause of IBSU? Or is it more about managing the symptoms?
It's usually more about symptom relief. For example, if someone is struggling with an overactive bladder, their doctor might prescribe anticholinergics.
Anticholinergics, big word. Break that down for me.
They basically block the nerve signals that tell your bladder muscles to contract. So they help calm things down and reduce those gotta-go feelings.
So they're like the chill pill for your bladder.
Pretty much. And you know how we were talking about the gut-brain connection? Well, sometimes addressing mood disorders like anxiety and depression can help with IBSU symptoms too.
Right, because stress can be a major trigger.
Exactly. So a doctor might consider antidepressants to help manage that aspect.
So it's all connected.
It really is. And here's something else that might surprise you. Physical therapy can also be a game changer for IBSU.
Wait, physical therapy? I thought that was for like when you pull a muscle or something. I know, right? When I think physical therapy, I'm picturing like athletes rehabbing injuries, not something like IBSU.
Yeah.
So tell me more about this. How can physical therapy help with bladder problems?
So it's all about these muscles you might not think about very often.
Yeah.
Your pelvic floor muscles.
Okay, the pelvic floor. For those of us who like skipped anatomy class, can you give us a little refresher? Where are those muscles and what do they have to do with IBSU?
Yeah. So your pelvic floor muscles, they're like this hammock that supports your bladder, your rectum. And for women, they're uteruses. And they're super important for bladder control.
So basically, if your pelvic floor is weak or not working properly, you're more likely to have accidents or those sudden urges to go.
Exactly. And think about it. These muscles can get all tight and tense from things like IBS, chronic stress, even pregnancy and childbirth.
So all that tension we were talking about earlier, it starts in the pelvic floor.
Exactly. And that's where pelvic floor physical therapy comes in.
Okay, so what happens in pelvic floor physical therapy? Are we talking like squats and lunges for your pelvic floor?
Not quite. It's more about gentle stretches, exercises to strengthen those muscles.
Yeah.
And then the therapist might actually use their hands to release tension in those deep internal muscles.
Oh, wow. So it's like a deep tissue massage for your pelvic floor.
Kind of. And it can be really effective for a lot of people with IBSU. Less urgency, fewer accidents, even reduced pain during sex. It's pretty amazing.
Wow. That's incredible. I'm sold. Okay, so we've got diet, medication, physical therapy. Anything else we should know about?
We can't forget about the power of the mind. Remember how we were talking about the gut-brain connection earlier?
Yeah, how can I forget?
Well, psychological therapies like CBT, cognitive behavioral therapy, and mindfulness can be really helpful for IBSU too.
Okay, now this is where things get really interesting for me. Explain it to me like I'm 5. How can talk therapy or meditation actually help with bladder problems?
So it's all about recognizing that IBSU isn't just a physical thing. It's also about how our brain interprets and reacts to those sensations.
So, like, our thoughts can actually make the physical symptoms worse.
Exactly.
Yeah.
CBT can help you identify and change negative thought patterns that might be contributing to your IBSU. For example, if you're constantly worrying about having an accident, that anxiety can actually trigger those bladder spasms, and it turns into this vicious cycle.
Oh, wow. So you're basically rewiring your brain to react differently.
You got it. And then mindfulness practices like meditation and deep breathing can help calm your nervous system, reduce stress and anxiety,
Oh,
which
yeah.
we know can trigger those gut-brain miscommunications that contribute to IBSU.
It's like hitting the reset button on your whole system. Okay, so we've covered a lot of ground here. We've got diet, medication, physical therapy, psychological therapies. It's a lot to take in. Where does someone even begin if they're thinking, okay, I think I might have IBSU? What now?
It's definitely a lot. But the most important thing is to remember, you're not alone.
Yeah.
Millions of people, especially women, are dealing with this. So first things first, reach out to a trusted healthcare provider.
Someone who will actually listen and take your concerns seriously.
Exactly. And don't be afraid to advocate for yourself. Keep a journal. Track your symptoms, what you're eating, any triggers you notice. That kind of information can be super helpful for your doctor.
Knowledge is power. The more you know about your body and what's going on, the better equipped you'll be to manage it.
Absolutely. And the good news is that research on IBSU is constantly evolving, so there's always more to learn.
Speaking of learning earlier, you mentioned the gut microbiome. What's the connection there, and why are scientists so fascinated by it?
So the gut microbiome is basically this whole community of trillions of bacteria that live in our gut. And it turns out they play a much bigger role in our overall health than we ever imagined, including, you guessed it, bladder health.
Wait, are you saying those tiny bacteria in our gut can actually influence our bladder?
That's what researchers are trying to figure out. Some studies are suggesting that people with IBSU might have different types or amounts of certain bacteria compared to people without the condition.
So it's possible these little microbes are sending out signals that are disrupting the bladder's mojo.
Exactly. It's like a communication breakdown between the gut bacteria and the bladder.
This is mind-blowing. So what does this mean for the future of IBSU treatment?
It's really exciting. Imagine a future where we can manage IBSU not just through lifestyle changes, but by actually manipulating the gut microbiome. Maybe through personalized probiotics or even fecal microbiota transplants, which is a mouthful, but it's also known as FMT.
FMT. Now that sounds seriously futuristic.
It does, doesn't it? It's like something out of a sci-fi movie. But it's showing some real promise for a lot of conditions, and research is ongoing for IBSU as well. It really speaks to the potential for personalized microbiome-based therapies down the road.
Wow. Who knew that the key to understanding and managing IBSU might actually be these little creatures living inside us? Incredible.
It is pretty amazing, and it just goes to show you how important it is to take a holistic approach to IBSU, looking at diet, lifestyle, mental health, and now even the gut microbiome.
This deep dive has been a wild ride. We've covered so much ground, from understanding the symptoms and causes of IBSU to exploring different management strategies and even getting a glimpse into the future of treatment. It can feel overwhelming, but the main takeaway here is there is hope and there are solutions out there.
I couldn't agree more. And remember, knowledge is power. Don't be afraid to ask questions. Do your research and advocate for your health.
Absolutely. If you're experiencing any of the symptoms we've talked about today, please reach out to your doctor. There's no shame in seeking help. In the meantime, keep learning, keep exploring, and keep asking those curious questions. Thanks for joining us on this deep dive into the fascinating and often misunderstood world of IBSU. Until next time, take care.